it's fully virtual. So let me just address a couple of matters here. For today's meeting, the chair or staff designated by the chair may mute participants' microphones when they are not under recognition for the purposes of eliminating inadvertent background noise. Members are responsible for muting and unmuting themselves. If I notice when you are recognized that you have not unmuted yourself, I will ask the staff to send you a request to unmute yourself. Please then accept that request so you are no longer muted. I remind all members that the 5-minute clock still applies. If there is a technology issue, we will move to the next member until the issue is resolved, and you will retain the balance of your time. You will notice a clock on the screen that will show you how much time is remaining. At the 1 minute remaining, the clock will turn to yellow. I want to say a thank you to Ranking Member Cole and other members of the subcommittee who are here, and thank all the members of Congress for joining us for Member Day. This is a unique opportunity and to gather input. We're focused on the Labor HHS Education Appropriations Bill, but it's a wonderful opportunity to hear from our colleagues on their district's priorities for the fiscal year. The bill that this subcommittee builds is the largest of all of the non-defense appropriations bills and impacts the lives of every single American. Through the subcommittee's fiscal year 2022 bill, we made investments to start tackling our nation's toughest challenges. We increased investments in high poverty schools for students with disabilities to expand access to post-secondary education. We strengthened life-saving biomedical research with increased funding for the NIH. We bolstered America's public health infrastructure with more resources for the CDC and state and local governments. We tackled the health crises, including maternal health, mental health, gun violence, substance abuse, while looking to reduce unacceptable health disparities. Supported middle class and working families with increased funding for childcare and development. Head Start, preschool development grants. We worked at sustaining good paying jobs through investments in job training, apprenticeship programs, and worker protection. And we included community project funding requests to meet the needs of communities directly. None of the achievements would have been possible without the input from our colleagues. So I'm glad the President's budget request for 2023 proposes continued investments in the programs that impact the lives of Americans. So as we begin to draft the 2023 appropriations bills, it's important to hear from our colleagues about your top priorities as you speak up on behalf of your constituents. So many thanks to all of you for being here. And with that, let me turn it over to Ranking Member Cole for any opening remarks.
Well, thank you very much, Madam Chair. And I want to thank you for holding this hearing today and providing a forum for our colleagues to come and present ideas to this subcommittee. I don't have a lot to say other than I want to associate myself with your remarks about the good work of this committee. I'm always pleased to point out that in the 7 years we've had the opportunity to work together, each in different roles. Sometimes chair went back and forth, but the reality is we found common ground 7 times in a row, and I'm looking forward to doing that an 8th time. But these hearings are a very important part of that process. I remember one occasion a number of years ago when one of our colleagues brought to our attention a relatively minor item in a program or a budget as large as ours. It was a $12 million program named after Helen Keller, and but important to train teachers we're going to work with students that were deaf and blind. You know, obviously a crippling condition, but one that we know the right education can do. And the member came in and made a pitch for that program. I wasn't familiar with the program, and I happened to ask our chief clerk at the time, could she look at that? And came back and said, yeah, it's funded at about 12 million, hasn't been raised in over a decade. And I said, well, I think we can fix that. And we did. And we're able to get a fairly substantial boost. We would have never known that probably had the member in question not brought it to our attention. So again, I encourage all of you that are testifying today to help the committee do its job. As the chair appropriately pointed out, we're proud of the things this committee does. It helps a lot of people and a lot of work. I again want to congratulate you, by the way, Madam Chair, for getting our hearing room named after our former chairman, Dave Obey. That was a wonderful event to be at, and saw a lot of old friends there, of course, including the chairman and his wife, Joan. But again, this is a good committee that does good work. We appreciate it when other members come and provide their input. So I look forward to working with my friend, the chair, and hopefully we can bring in another good bill, and hopefully that bill will be improved by what we learned today. So with that, Madam Chair, I yield back.
Thank you very, very much. And let me just say thank you for your participation, but just being engaged and involved with the effort on behalf of David Obey. It was really so much of a bipartisan effort, and you could feel the warmth and love in the room. And I would just add one more piece. You will recall a number of our colleagues coming to this subcommittee to talk about the issue of Down syndrome, from that hearing, we have made a very significant increase in funding for research for Down syndrome. So lest my colleagues think that this is just a perfunctory appearance, it's not. We really do are interested in what your concerns are and how we can really look at how we can appropriate funds for them. And I should also say that I enjoyed the best of a relationship with the ranking member on this subcommittee. And right, 7 bills, we're on to our 8th, and we're going to make it happen. So thank you very, very much. And with that, I've got the order here, and everybody's got their allotted time here. So if I can, let me recognize Congresswoman Mikey Sherrill from New Jersey to talk about her interests and in the labor HHS appropriations bill.
Well, thank you, Chairwoman DeLauro, Ranking Member Cole, and members of the subcommittee for providing me the opportunity to testify today. I also want to extend a special nod of acknowledgement and thanks to my good friend and colleague from New Jersey, Representative Bonnie Watson-Coleman, for her outstanding work to represent and support our state's priorities. This subcommittee has done crucial work to advance the needs of Americans throughout the country through the funding of community projects in fiscal year 2022 and through consideration of community projects for funding in fiscal year 2023. To that end, I want to speak today about a number of crucial projects that I've submitted on behalf of my district and the communities and constituents I represent. First, I'd like to submit to the committee the vital importance of funding the Community EMS Physician Response Expansion Initiative at RWJ Barnabas Health through the Health Resources and Services Administration. This initiative, already in place with one team based in Newark, incorporates many of the lessons we've learned from our military's overseas engagements into an innovative care approach that will help to provide critical life-saving assistance at the scene of emergencies in our communities. The program will build on an already successful initiative at RWJ Barnabas to bring ER physicians on ambulances to needed sites of crisis. For too many Americans, including in my district, crucial medical interventions are not available in time when they are desperately needed in the aftermath of an emergency. This funding will improve access to this care when it is needed most and will improve health outcomes and save lives in my community. The proposal received broad support from Essex County elected officials who attested to the significant benefits this project would provide. Second, I'd like to submit to the committee my strong support for funding a new pilot program to help the Jewish Service for the Developmentally Disabled incorporate technology in residential group homes, day habilitation, and private residential settings in northern New Jersey to provide greater independence and accessibility to residents. This funding will allow more of my constituents to live independently at home in their communities and will also help to address the home healthcare staffing crisis in residential homes. Furthermore, this technology already has a strong record of its success nationwide, with communities that have utilized it reporting a significant decrease in need for state funding of up to 50% for individuals served. Adults with intellectual and developmental disabilities have historically been underserved in terms of access to funding and technological innovation, and this community project will take one step towards righting that wrong. This proposal received strong support from the Healthcare Foundation of New Jersey, the Township of Livingston, and impacted members of the community. Third, I'd like to submit to the committee my strong support for funding to renovate and expand the Morristown Medical Center Emergency Department, which would replace the existing patient monitors and increase monitoring capabilities, construct additional negative pressure rooms to control airborne pathogens, and modernize the triage space. The Morristown Medical Center had over 100,000 emergency department visits in 2019 and is a vital lifeline to hundreds of thousands of families in northern New Jersey. However, the center's emergency department has not undergone a major renovation since 2011, and much of its equipment and infrastructure is already beyond its expected useful life. This investment will help improve access to effective, affordable medical care for so many people in my district and will improve quality of life throughout our community. It's no wonder that this proposal received broad community support from Morris County elected officials, including members of the state assembly and our sheriff. Finally, I want to submit to the committee the crucial importance of funding student scholarships at William Patterson University to support college completion for students impacted financially by the COVID-19 pandemic. Over the past 2 years, many students have temporarily or permanently withdrawn from their institution of higher education, and approximately 40% of William Patterson University students who have not returned to school have cited financial related reasons. Access to higher education is a critical path to the middle class for millions of Americans, including so many in my district. But the pandemic could take away much of that opportunity unless we act to support students. This funding will be used to ensure that students can re-enroll in the university, continue their studies, and access supportive services and programming. It will play an important role in helping to increase college attainment levels in Passaic County, which currently has the third lowest rate in New Jersey. This project received letters of support from both the County of Passaic and from several local mayors who indicated the significant community impact these scholarships would have. These 4 community projects will make a crucial difference in the lives of tens of thousands of people in my district and will provide a sizable return on investment through improved health, reduced costs to taxpayers, and expanded educational attainment. I greatly appreciate the subcommittee's work to support members' proposals and urge you to include these valuable projects in the FY 2023 LHHS appropriations bill. Thank you again.
Thank the Congresswoman for her testimony and the quality of the community projects that have been submitted. I think overall that we're very excited given what happened in 2022 and our ability to fund community projects. And on both sides of the aisle, I know I've heard from my colleagues on both sides of the aisle of how successful this effort has been in really demonstrating the community need, because we know that there has to be documented community support for these efforts and not just one's own wish or hope or what members that it's directly related to the community. So it really is proving to be almost really a necessity for some of our local communities in order for them to address some of these efforts. Let me ask my colleagues if they have any questions of Congresswoman Sherrill.
I don't, but I want to just quickly associate myself with your remarks again. Sometimes members really do understand their districts better than officials far away in Washington, D.C. And it's just invaluable when they come in and point out what the local needs are and that there is support for these things. So again, I want to thank all our colleagues that are doing that today. And again, thank you, Madam Chair, for holding the hearing.
Thanks. And I would just add one more thing. We are going to do as best we can to, acknowledge and be able to fund the projects. So much will depend. And I might add, there are increasing numbers coming in, so that let me just put it this way: we're going to do the best we can to see how many that we can get done, this go around, because we understand the value and we understand the need. So thank you very, very much for your testimony this morning, Congresswoman. Really appreciate it. Thank you. And with that, let me recognize, I see Congressman Van Drew is not going to be joining us this morning. So then let me recognize, Oh, I didn't ask my other colleagues. Congressman Harris, Congressman Klein, do you have any questions? Okay,
No, I'm fine.
fine. Thank you. Thank you. So let me ask Congresswoman Veronica Escobar for her testimony this morning. Congresswoman Escobar, and I see you have a guest.
I know. I am so
That's
sorry.
fine. That's fine.
He loves the Zoom, so my apologies.
No problem. No problem.
Well, thank you so much, Chairwoman DeLauro and Ranking Member Cole, for hosting this Member Day hearing. I have the honor of representing El Paso, Texas in Congress, and I am so grateful to have the opportunity to be advocating for the needs of my community. This subcommittee has played a critical role in helping communities like mine overcome the many issues the COVID-19 pandemic has presented us over the past 2 years. And I look forward to working with you this fiscal year to address the many challenges still facing El Pasoans. I'd like to begin by first thanking the subcommittee for the $900,000 increase allocated in the fiscal year 2022 omnibus for the U.S.-Mexico Border Health Commission. Unfortunately, for years, the U.S. section of the commission was overlooked and underfunded. This became increasingly apparent at the beginning of and during the COVID-19 pandemic, when the border region was disproportionately impacted by the virus. The funding increase this subcommittee allocated is giving the U.S. section the ability to again re-engage with their Mexican counterparts, begin work on Healthy Border 2030, and perform basic functions like hire more staff and maintain a permanent office in El Paso. However, it's critical that we keep providing the U.S. section of the Commission with the resources it needs to continue to play a role in binational health policy. That's why I support the President's fiscal year 2023 request to increase the Commission's funding by $900,000 and urge the subcommittee to include this funding in your final bill. Next, I'd like to thank the subcommittee for providing funding for my community projects in fiscal year 2022. These projects will have an immediate impact on those who need it most. That's why I'm excited to discuss the projects I've submitted for your consideration for the fiscal year 2023 community project process. The first project is the El Paso Children's Hospital Pediatric Mobile Clinic. If funded, this project will play a key role in expanding healthcare to traditionally underserved parts of El Paso, like colonias. El Paso Children's Hospital would use these funds to purchase and outfit a mobile clinic with the goal of providing both basic and specialty pediatric healthcare throughout El Paso County. It would also allow the hospital to provide several other services, like administering flu shots to young El Pasoans who are unable to visit a doctor regularly. The second project is the Texas Tech University Health Sciences Center El Paso Border Health Center. I truly believe the border region is a unique place that faces its own challenges when it comes to healthcare. Our majority Latino population has seen dramatic increases in chronic diseases like heart disease and diabetes. But because the border region is vast and diverse, it's difficult to keep track of these trends. The proposed Border Health Center would create a telemedicine and monitoring program to provide early interventions to slow the rise of chronic diseases while also conducting research to benefit federal agencies. This transformational project would help change lives by trying to better understand the root causes of the healthcare challenges we face on the border. The final project is the El Paso Independent School District After School Community Learning Center. This project would allow the school district to expand after-school learning programs to parts of the community that are traditionally underserved, like Segundo Barrio. By extending more resources to these parts of the city, the school district will be able to reach more students and give them the tools they need to succeed. I'd like to once again thank the subcommittee for your leadership and for this opportunity and for thank you in advance for consideration of my requests. And I yield back.
There we go. I did not mute myself here. So I'm going to ask my colleagues if you have any questions. Congressman Cole?
No.
No. Congressman Harris?
No.
Congressman Klein? No. I want to just say, it's not a question, but thank you for taking such an interest. I know this is the Labor HHS subcommittee, but these are the issues you're focused on. But I've watched what happens with mobile clinics. I think we all have, which can get around to the underserved areas, as you point out, and how critically important they are. I am a product of the after-school program, and I say a product. I taught in an after-school program many years ago, it's just we don't warehouse children in these programs. We actually, provide them with learning experience and art and culture, et cetera. And it's a wonderful way for parents who are working to make sure that their kids are safe. So I thank you for your focus on the health issues and on the education issues that are really so critically important to youngsters today, and in a region that has an underserved population that we need to try to focus on. So thank you very much for your testimony this morning. Thank you. Let me now recognize Congresswoman Kim Schrier from Washington State, and love to have your testimony.
Good morning, Chairwoman DeLauro and Ranking Member Cole. Thank you very much for the opportunity to testify to your committee about a few issues of great importance to me and my district. Specifically, I want to address funding for the Pediatric Subspecialty Loan Repayment Program, funding for the Public Health Emergency Preparedness Cooperative Grants, and two of my community project submissions, Central Washington's Student Medical and Counseling Center air ventilation upgrades, and the Heritage Heights Memory Care at Lake Chelan. So the first program I want to speak about is the Pediatric Subspecialty Loan Repayment Program. The goal of this program is to make sure that children in rural areas get the care that they need. Millions of children reside 1.5 hours or more away from access to specialty care. This was always a problem, but the pandemic has increased the need, particularly for mental health care. And the cost of pediatric subspecialty training is steep. Few students coming out of medical school think that they can pay back their loans if they practice in small or rural communities. So we need to incentivize specialty providers to practice in these communities. So this program rewards providers who practice in rural and underserved areas for at least 2 years. When providers train and start practicing in rural areas, they often become part of the community and are more likely to stay. And this important targeted investment works to address the overwhelming medical school debt that serves as a barrier to training in pediatric medical, surgical, and mental health subspecialties. And I respectfully request $30 million in funding for the Pediatric Subspecialty Loan Repayment Program. The second program I want to discuss is the Public Health Emergency Preparedness Cooperative Agreement, or PHEP grants. This is the main federal program that supports the work of health departments in preparing for and responding to all types of disasters, including bioterrorism, natural disasters, and infectious disease outbreaks. The response systems, personnel, and infrastructure that states require to respond to public health emergencies like COVID-19 would not exist in most states without PHEP funding. These grants help states swing into action in all sorts of disasters. In my home state of Washington, PHEP grants allowed the health department to form an epidemiology task force in response to a mumps outbreak, for example. And this task force supported local health departments with case investigation, disease surveillance, and risk communication activities. We know COVID-19 caused substantial burnout in the public health field, and resources are stretched thin. Substantial funding will allow these entities to rebuild and move forward, and I respectfully request that the committee provide $842 million for this program. Last, I would like to speak on two community projects that I submitted to this committee. The first is a project to upgrade the Central Washington University Student Medical and Counseling Center medical grade air distribution. Central Washington University needs to upgrade their air filtration system. The current HVAC system has not been updated since the 1970s, and an upgraded air system will keep both staff and students safe as they wait for needed medical and mental health appointments. The rural city of Ellensburg depends on the university, and the university depends on healthy staff and faculty and students to keep it running. And especially in light of the COVID-19 pandemic, these upgrades are necessary. And I respectfully request $2 million for this project. The second is for Heritage Heights at Lake Chelan. This is a senior care facility in a rural part of my district that is converting part of their facility to memory care. Currently, there are no memory care facilities within 40 miles of Lake Chelan and no nearby facilities except Medicaid. This means that seniors with dementia and their families have few options in the Chelan Valley for memory care. And the conversion will allow for seniors who need assisted living and memory care to get their care close to home. It will make possible for them to age nearby their families, their doctors, and existing support systems. And I respectfully request $800,000 for this project. Thank you again for the opportunity and the opportunity to testify on issues that are very important to my constituents. And I yield back.
Thank you. Let me yield to my colleagues, Congressman Cole. Any questions?
I actually do want to make a couple of quick comments. First of all,
Sure.
I want to, again, thank the gentlelady from Washington for coming, but I want to associate myself with the two programmatic requests that she made. It's a little bit early to talk about dollars because we obviously don't know what our top line for the full agreement is, let alone our allocations by the subcommittee. It's a little early, but I think she puts her finger on two really important programs in terms of long-term preparedness. And I represent a district that has the same challenges in terms of getting specialty care into relatively remote areas. And I think the emphasis on pandemic preparedness, I mean, we shouldn't have to learn this lesson again. I think this committee did a lot of good work leading into the pandemic, and I'm proud of what it did. But this is an area where we probably just simply need to do more. Again, I think those are both excellent requests, and certainly the specific community requests. Again, I have the same issue with, for instance, constituents with dementia that can't get care anywhere close to where they live. So I understand the utility of those kinds of requests. And again, thank the gentlelady for coming and testifying before our subcommittee.
Thank you, sir.
Thank you. Congressman Harris?
No questions. Thank you.
Thank you. Congressman Klein?
No, thank you, Madam Chair.
Thank you. I just want to say as well, I do associate myself with the ranking member's comments about the programmatic requests that I think they're really, critical efforts. And we're right, we don't know about what the dollars amounts are yet, but really in terms of preparedness, we need to continue to look at how we support efforts and the CDC's efforts on preparedness. I think I look at teacher shortage. I look at the pediatric subspecialties here, and in all of these areas, I think we do need to look at how we deal with loan repayment programs so that we can encourage people to move in. I just wanted to say this one last comment. We are really very fortunate in this Congress, Dr. Schrier. Your background in pediatrics, your background in health, really brings to the fore the critical issues that we need to, that we need to face, and that kind of knowledge. This is it. You make these proposals out of the science and the knowledge of your medical profession, and for that we are really very grateful. So thank you so much for the testimony. And
thank you, Madam Chair. Mr. Ranking Member, we are very grateful for you, and a point of privilege, thank you for your work with the USDA to get so many of our projects.
Here. We're done. It's done. It's done. Thank you.
Thank you.
Okay. So take care. And with that, let me recognize Congresswoman Sylvia Garcia from Texas, and about community projects. So Congressman Garcia.
Thank you, Madam Chair, and thank you, Mr. Ranking Member, and all the committee members for having me here this morning to talk about my priorities for the Labor, Health, and Human Services Subcommittee for this next year. Madam Chairwoman, earlier this year, the 2020 Census Community Survey revealed that my district has the highest number of uninsured rate in the nation. Madam Chair, this is not a number one that I sought. This is incredibly alarming, and that's why many of my appropriation requests this year revolved around healthcare and creating jobs where employees can attain high-quality health insurance. I would like to flag that several of my community project requests for the committee. First, El Centro de Corazon, a federally qualified healthcare center in the FQHC, is in my district. We are requesting $5 million in funding for construction and equipment costs to build an additional 10,000 square foot healthcare facility. This facility will increase capacity to provide more women and children with accessible and affordable healthcare services. Services will include prenatal care, contraceptive management, ultrasounds, and well woman exams. Madam Chair, as you're well aware, women's healthcare is under attack in Texas. So this project will be a step in the right direction to put and maintain more healthcare for women in my district. Additionally, I have nearly $4 million in community project dollars for an Access to Health Smart Pods project. This community project seeks to address the healthcare disparity in multiple locations across my district through the deployment of innovative, award-winning Access to Healthcare Smart Pods developed by Baylor College of Medicine. A smart pod is like a mobile healthcare facility unit. There will be 10 pods, half of which are equipped to provide primary care and half of which are tailored to provide mental health services, will be deployed across 4 popular community centers in 1 county park. These self-contained pods cost-effectively provide the full range of primary care and mental health services to areas that lack healthcare services. I have visited these pods. There's 1 or 2 already in action, and I can tell you that firsthand, I've seen this and it works. It is about taking the healthcare services to the underserved and hard to reach communities. And it will be a great addition to services in my district. Finally, Madam Chair, I will flag the project for one of my school districts, Pasadena Independent School District, called the High School to High Wage Project. This project will help Pasadena ISD ensure their students have access to proper and up-to-date equipment, resources, and training so they are prepared to enter the workforce and fill employment gaps in high-demand, high-wage occupations. These are not just any jobs. These are jobs vital to the economic and social economic success of my district and the greater Houston area. Statewide and regional data indicates that jobs in the healthcare industry, trades, and STEM-related fields are being impacted by the most by the shortage of qualified employees. And Pasadena ISD is addressing that. The school district, working closely with business and industry partners, are work together to ensure that they are preparing their graduates to fill these high-wage, high-demand positions. Getting our students the opportunity to get into high-paying, high-quality jobs means they are more likely to attain high-quality health insurance as well, which of course will improve our numbers. I'm happy to answer any questions you may have. Thank you again. And I too think that Dr. Schrier is a great addition to the Congress, and I thank her and your committee for acting swiftly on our baby formula crisis. Thank you. And with that, I yield back.
Thank you. Let me yield to my colleague, Congressman Cole, for questions.
No questions. All seem very worthy projects.
Thank you.
Congressman Harris.
No questions. Thank you, Madam Chair.
Congressman Klein.
No questions. Good to see my colleague from Texas.
Thank you. It's again startling, the highest, rate of uninsured in the country. Something to be concerned about. And I just I'm over and over again just taken with the quality of the projects that are really bubbling up from communities in your district with the Pasadena Independent School District and where you want to go there, and the health issues that you want to again, the smart pods. I would love to see one of those myself and to see how that works. But any way in which we can be better delivering services, which is what your focus is here. So I think members, including yourself, Congresswoman Garcia, have really focused in and worked very closely with the local groups, with local government, in trying to really ferret out the very specific and critical needs of your community. So many, many, many thanks for your work and for your testimony and for the submissions. Much appreciated. Thank you.
Well, thank you, Madam Chair. And anytime you want to come to Houston, I would certainly invite you during our great rodeo week.
Okay.
But any time would be great. I know I've spoken to Secretary Becerra, and he hopes to come down and help me bring the issue of the uninsured and signups in several areas. So anything I can do, and certainly would welcome your help in decreasing that, because as I said, that's a number one I did not seek, and I don't want to be on.
Right.
So working very, very hard to turn those numbers around.
You're here. I know you will. And with that, thank you very, very much for your testimony this morning.
Thank you so much. You all have a great day.
Thank you. To my colleagues, there are no more members who are testifying. I think people being at home for this week and running around their districts, which is a good thing to do, have fewer members participating. But I want to just say thank you for your help here this morning. And I guess we go on this Thursday, I believe, to listening to public witnesses, and of which there are a number. So we will have a full schedule on Thursday. But thank you very, very much. And again, to all of us in a very bipartisan way, I think people have really honed in, and it's really so reassuring to see the quality of the projects that people are bringing forward. There was so much skepticism around revisiting community projects, and I just feel good, and that is a testament to all of you here and our colleagues who understand, as you pointed out, the ranking member, that members know their districts the best. They really do, and I think we're seeing evidence of that. So thank you all very much. And with that, I got a gavel.
Thanks, Madam Chair.
Is adjourned.